You're here today at the 4th Annual National Conference on Health Disparities.
I am.
How do you find that being with the Black Caucus Foundation, why do you see the need for this type of conference to be held?
Especially now, more than ever, it's really important for people to understand the scope of health disparities, what it is, what impacts health disparities, and what kind of efforts are being put out at the federal policy level especially, to address the issues that really surround health disparities. One of the most landmark efforts that has been put into place most recently, obviously, is the passage of the health reform law. It's an incredibly comprehensive piece of legislation that really looks at all of the social, economic, and really sort of systemic factors that impact health disparities, and really has the potential to galvanize both healthcare outcomes as well as our healthcare system. And a lot of these issues were actually talked about during this conference. So it's incredibly timely and really, really important for people, not just who are working actively within the healthcare system, but for people who are interested in, really in general, in really seeing our healthcare system change, become a lot more proactive versus reactive, are really interested in working on changing costs, both on a personal level and within a systemic level, as well as understanding what they themselves can do on a personal level to really be able to make a difference, within their own lives, but also to really impact the system as a whole.
Last question. The Black Caucus Foundation,
Yes.
Do you all have any resources or any information that you can share with the Black community that can help them?
Funny that you should mention that. As a matter of fact, we do. We have a community guide on the health reform legislation that we just released. As a matter of fact, it's getting distributed for the very first time at this conference. So we're very, very excited about this, literally hot off the press. And the guide really breaks down all of the health equity related provisions in the legislation. So it really helps to explain to people how the different components of the legislation can impact health equity. Ultimately, that's really what we're trying to achieve here. It's better health outcomes, short-term and long-term, and a better healthcare system for all people, so that we see over time fewer and fewer disparities between the white population and racial and ethnic minorities. That's really what this legislation is trying to do. The guide is very, very comprehensive. It includes a breakdown of the key components of the legislation, a timeline for implementing the different aspects of the legislation, as well as information on the different federal agencies that will be playing a role in implementing the law, and the role of state health agencies as well. It's also got information on the financial provisions and basically what's going to be dispersed when, and which agencies people can contact to find out more about the different provisions that will be available. The guide is absolutely free. We're very, very pleased to be able to announce that. It was actually produced by one of our former fellows. We have a fellowship program, Congressional Fellowship Program, and one of our former fellows produced it in collaboration with a wonderful researcher who works for the National Medical Association's Cobb Institute. So we're really, really excited about this partnership and having been able to put together this publication. And if people are interested in getting it, they can contact us at 202-263-2800, or send us an email at cpar, that's C, P like Paul, AR, at cbcfinc.org for the Congressional Black Caucus Foundation.
Wonderful. Excellent.
Thank you so much.
Thank you for your time.
Absolutely.